Hello, and thanks for joining us today for the latest Technology Networks webinar, Optimizing the Laboratory to Support COVID-19 Testing. I'm Rebecca Corkill, a scientific content creator at Technology Networks, and I'm here to moderate the event. I am pleased to have Lauren Taylor joining us today as your presenter. A warm welcome to you. Lauren Taylor is a solutions manager for digital science, responsible for the development of pre-configured genomic solutions on Thermo Scientific core LIMS software and Thermo Scientific SampleManager LIMS software. She has led and contributed to many projects, including solutions for COVID-19 testing, COVID-19 research, and next-generation sequencing. Lauren earned her PhD in cell and developmental biology from University of California at Irvine prior to joining Thermo Fisher Scientific. Her work helps researchers drive productivity, ensure compliance, and streamline workflows. Following the webinar, we will have a Q&A session, and we welcome any questions that you may have. You can submit questions for the Q&A session at any time during the presentation. To ask a question, please click on the chat icon in the bottom right corner, enter your question into the box on the right-hand side of your screen, and click Submit. We will answer as many questions as possible during the time available. For any questions we don't have time to get to, we will ensure you're contacted offline with an answer. Please remember you can ask questions at any time, even whilst watching the webinar on demand. So without further ado, I will now hand over to Lauren.
Thank you so much for joining me today to talk about optimizing the laboratory to support COVID-19 testing. It has been a really crazy year around the world, and each and every one of us has been affected by this pandemic somehow, whether it's because we've survived it or we're trying to keep our loved ones safe from it. And one of the things we can do at a community level is to test people so that individuals infected with the virus can isolate as soon as possible and then prevent further infections in the community. Now, scaling up testing comes with some challenges. So how can we address that? Globally, governments and organizations are scaling up their COVID-19 testing. And of course, it's especially important for healthcare workers to have regular tests to avoid spreading the virus to their colleagues or their patients. Routine testing is being deployed now in workplaces and schools, colleges, and university settings to enable everyone to continue to work and study safely. What's needed is a proven testing solution with established workflow connectivity. The urgency to implement reliable and scalable testing workflows is pretty clear, and software is a big part of that. Software is used to manage the workflow and ensure data integrity. Any sort of manual transfer of data in the workflow, beginning with a test request and ending with the results report, is not only slow, but susceptible to errors. Software can automate data transfer, speed things up, and eliminate the potential for the kinds of errors and delays typical of manual data transfer. Also, any COVID-19 testing system needs prompt support in the event of any issues and needs an uninterrupted supply of materials to perform the testing. So a vendor has to have an established, solid infrastructure and supply chain to provide services and support and ensure continuous testing. So let's start looking at what's involved in the COVID-19 testing workflow at a pretty high level by following the life cycle of a sample to be tested. It starts with an individual being swabbed. This might be in a clinical setting, could be at a community center, employer site, school, university, or even at home these days. Then an order for the test is placed, and likely that's going to be in electronic format, but it could also generate a paper requisition form. The sample's then packaged and shipped or delivered to a lab for testing. At the testing site, someone's going to receive that package. Usually it's subject to some kind of preliminary inspection and a determination is made around whether to accept or reject the sample. Maybe the container is damaged in transit, or the identifiers on the sample are illegible or something like that. Then the paper or digital requisition form is used to input the unique sample identifiers into the lab's information management system software, or LIMS. If the sample is accepted, it moves on to the next step in the process, which is to extract the nucleic acid from the sample. If a sample is rejected, then a new order would be needed and a new sample collected. The nucleic acid of a sample might be extracted either manually by a technician, or more often it's done through automated instrumentation. After that, the samples are prepared for real-time PCR in either 96-well or 384-well plate format, depending on the lab's equipment and their expected throughput. Then the data is analyzed and a positive or negative determination is made, and those results are associated with the sample in the LIMS software and reported out to the patient or the requester of the test or any required reporting agency. Thermo Scientific is uniquely positioned to support COVID-19 testing, as we have the software, equipment, reagents, and instrumentation to support every step in the COVID-19 testing workflow, from sample handling through data interpretation. We offer everything from swabs in barcoded tubes for sample collection, COVID-19 testing kits, instrumentation for automated nucleic extraction like the Kingfisher, real-time PCR systems, and software to make the positive and negative COVID-19 calls, as well as SampleManager LIMS software to support COVID testing workflows. And all of these items are designed to work together. So now let's dive a little deeper into the lab and data management software. So a few slides back, we touched on how important software was to manage the testing workflow and preserve data integrity, and how any system needs prompt support in the event of any issues. Well, as a company, we've been a provider of informatics products and services for over 30 years. We have more than 380 employees dedicated to informatics, and over 160 of those are in-house service and support personnel. We also have extensive system and instrument integration capabilities to ensure a complete workflow. And with over 1,400 LIMS installations globally, we have the experience and proven track record of supporting our customers. So today, I'm going to tell you about a pre-configured COVID-19 testing solution that's available for Thermo Scientific SampleManager LIMS software to support labs and testing sites with scaling up their testing capabilities. A pre-configured solution like this one will get you deployed and testing quickly compared to a standard LIMS implementation, and one that can scale easily as the lab's testing volume changes over time. Another benefit is that it's built around the gold standard instrumentation and protocols for COVID-19 testing. Included in the solution are dashboards to guide users through the COVID-19 testing process. There's a mobile application to support sample receipt and accessioning. This solution can also support CAP accredited or CLIA compliant labs. It's been built for compliance and data integrity. And it ensures correct execution by guiding users through the process. It's a scalable solution with a proven track record that's been deployed globally. So this pre-built configuration for COVID testing streamlines operations and ensures consistency, efficiency, and productivity. So let's take a little closer look. I'll start with a high level, very simplified illustration of the COVID-19 testing workflow. A series of activities are going to happen, starting with sample collection and ending with results reporting. Now, we're aware that some testing sites might already have partnerships or use software services to perform test ordering, invoicing, results delivery, and case management. So the pre-built COVID-19 testing solution for SampleManager LIMS has been configured keeping that in mind and enables integration with third-party software for the sample collection and results reporting activities, which in this illustration are designated by white open circles at the start and the end of the workflow. We have experience with configuring these types of integrations to provide a seamless user experience. Examples of third-party providers are companies like Color Health, Everlywell, and LK. So the workflow begins with sample collection where the samples are collected and orders for the tests are placed, and then these are boxed up and shipped to the lab. The activities designated by closed blue circles in this illustration are steps that happen within the SampleManager LIMS COVID-19 testing solution. So samples will be received by the testing lab, and a technician's going to do a preliminary visual inspection, and the items are going to get entered into inventory. The next step is to prepare those samples for further processing by placing into 96 well plate format, which is likely going to be done using a liquid handler. The RNA is extracted from the samples, and then depending on the lab's equipment and throughput expectations, they might want to take up to 496 well plates worth of samples and compress those onto a single 384 well plate. Samples in either 96 or 384 well plate format will proceed to real-time PCR testing. Raw data then gets analyzed by interpretive software that makes the positive and negative calls. And those results get pulled into the LIMS software and associated with the correct samples. That information can then be reported out either through the third-party software or as results reports directly from the LIMS. In addition to just the direct steps in the COVID testing workflow, the solution supports the full lab process, including printing barcode labels for containers, managing reagent and consumable inventory, and managing instrument maintenance and calibrations. Data transfer from instrumentation like liquid handlers and from interpretive software is set up to happen automatically. And results can be delivered via email, HL7, or web. It's all set up to minimize errors and ensure data integrity. Let's get into more specifics of the pre-configured testing solution and what it looks like. The solution was built on Thermo Scientific's TaqPath COVID-19 EUA or CE-IVD testing protocol. The protocol includes testing of swab samples, use of the Kingfisher instrument with MagMax nucleic acid isolation kits for the RNA isolation step, applied biosystems real-time PCR systems like the 7500 or the Quant Studio instruments, together with the TaqPath COVID-19 testing kits, and analysis using applied biosystems COVID-19 interpretive software to make the diagnostic calls for detection of the SARS-CoV-2 virus. While the LIMS isn't part of the EUA or CE-IVD protocol, the pre-built solution seamlessly integrates with all the components for this protocol. So let's dive in and see what the solution looks like. This is the landing page within the COVID-19 testing solution in SampleManager LIMS. I'll give you a little tour. On the far left side, we have the left-hand navigation column. There's a series of icons here that follow the main workflow steps. Each icon takes you to the dashboard for that particular workflow step, starting with sample receiving. Below that is nucleic acid extraction, then qPCR, and then the review and report step. We also have an operations management dashboard showing some of the lab's key performance indicators. We'll check out that dashboard a little bit later in the presentation. The tiles across the top going from left to right indicate the number of samples awaiting at each step in the process. In this instance, we've got 190 incoming samples. So samples that will be arriving in the lab that will need to be received into inventory. There's 95 samples ready for extraction, 380 samples ready for qPCR, and 91 samples waiting to be reviewed and authorized. So clicking on any of these tiles will show you the list of samples at that workflow step. The table below the tiles is an easy and quick way to do any sort of sample search. So users can scan or type in a barcode to pull up a sample, or specify the number of prior days and get a list of samples registered in those prior days, or really query any attribute of the samples. So let's check out the dashboards and the workflow steps. Let's start with the sample receiving step of the workflow. Once the samples arrive at the laboratory, the operator or the technician will unbox them and perform a visual inspection of the arriving samples. We're expecting that the vast majority of the samples are going to arrive in good condition. But of course, we know that a small subset of samples might show up in the lab with some kind of an issue. So this screen allows the operator to quickly scan in the sample vial barcodes, receive the good samples into inventory, and assign them to a location. Any samples that are rejected can also be scanned in with a received condition attribute of bad and some context around why the sample was rejected, like damaged vial, loose cap, compromised packaging. If there's an integration to a third-party portal, the sample receipt status and the unique sample identifier information are transmitted so that a new sample can be requested. Once there's enough samples to batch together, typically they go onto a liquid handler instrument for 96-well plating. The LIMS solution is configured to automatically pull in the data output from the liquid handler and trace plate barcodes and sample well locations. The plates are then ready to proceed to RNA extraction. Navigating to the nucleic acid extraction dashboard, we have a list of our plates that are waiting for RNA extraction. Here we can select our plate that we're proceeding with and enter any relevant information for this step in the process. So we enter or scan the barcode of the final elution plate. We indicate which instrument will be used for the extraction and identify the kit used. And these can be easily selected from dropdowns. It's possible too that the lab might have different protocols depending on the sample types. So you also have the option of tracking which protocol was used for the extraction if there's more than one. And all of this information will then be associated with the samples for tracking and tracing purposes. Once the extraction is complete, the plates can proceed to real-time PCR analysis. Or there's the optional step of compressing up to 4 96-well plates onto a single 384-well plate for processing. The compression step would typically occur on a liquid handler. And again, the LIMS solution is configured to automatically pull in the data output from the liquid handler and trace plate barcodes and sample well locations. The qPCR dashboard now shows us the list of plates, 96 or 384 well, that are available for this step in the workflow. From here, we can easily capture the information we need to track, like the qPCR plate barcode. And from a pre-configured drop-down menu, we can also identify the instrument that's going to be used and the specific qPCR kit, like the TaqPath COVID-19 combo kit and its lot number. Once this is done, The LIMS software generates a file that can be uploaded to the 7500 or the QuantStudio real-time PCR instrument, and it contains all the sample and plate information needed for the plate setup in the instrument software, including the detector and the task information. After the qPCR run completes, that data is analyzed by the Applied Biosystems COVID-19 interpretive software. That data is then automatically brought back into the LIMS software and associated with the corresponding batches and individual samples. Then we can move to the review and report dashboard and see the plate batches that are ready to review. As the reviewer, you can easily view and authorize the results by batches of plates. Upon authorization of the results, if there's integration to a third-party portal, the results and the unique identifier information will be transmitted. But it's also possible to print records for batches of samples or individual samples from within the SampleManager LIMS. In the case where the COVID-19 interpretive software makes a call of invalid or inconclusive, those samples are going to be pulled from the queue and listed on the failed samples tab on this dashboard. Those samples and all their associated data can be reviewed and either reprocessed if enough material is available in the lab, or a new sample can be requested. So we've just completed the workflow from sample receiving through results authorization and reporting. So let's take a look at the lab's performance. So as a manager of the lab, it might be important to get an overview of what's going on in the lab. So here's an example of the operations management dashboard. Here we can see how many samples have been processed in the last 24 hours and how many tests were positive in the last week. Other key performance indicators include average time to extraction, average time to qPCR, and average time to results report over a specified number of days, all to help gauge the lab's efficiency and productivity, to help identify any issues or challenges easily and early. Included is also a graphical representation of the number of samples processed daily, showing the number of samples that resulted in positive, negative, or inconclusive results. From the left-hand navigation pane, we can easily navigate to more dashboards, ones that help manage reagents, instruments, and locations. So we've reviewed the specifics around the COVID-19 testing solution for SampleManager LIMS, but how else can SampleManager LIMS software help manage some of the other issues facing labs today? Things like demonstrating compliance, ensuring that scientists and management have access to the data and the information they need, and being able to produce accurate, reliable results. SampleManager LIMS software can be configured to enable compliance. Standards exist around resources, process requirements, and management system review. So resource standards require that the laboratory ensure it has everything that it needs to do the work, that equipment is calibrated properly and maintained regularly, that reagents are in stock, and that any externally provided services and products are of a suitable standard. Process standards are meant to ensure that the correct methods are used to deliver accurate results, that records are kept, that labs have processes in place to manage any issues or non-conformances that occur, so that repeat issues can be avoided, that any electronic data management system used is validated and protected to ensure the validity of the results and security of the data. The management system review standards require that there's a system in place which enables management to easily review how the lab is performing. SampleManager LIMS software can be applied to help achieve these kinds of standards, as well as support CAP accredited or CLIA compliant labs. Inventory management features within SampleManager LIMS software can help manage stocks of consumables, reagents, and other chemicals, including safety handling data, and carefully monitor your lab inventory. Stock and inventory dashboards provide up-to-date overviews of resources, and stocks are automatically decremented as they're used, helping reduce waste and ensure that essential supplies are always available. The instrument management feature tracks the calibration and maintenance of equipment and instruments, allowing for scheduling of these activities in advance, ensuring maximum uptime. From the dashboard, you can easily see a list of instruments that have a status of maintenance due, requires calibration, requires servicing, or unavailable. It's also possible to manage training records with SampleManager LIMS. Not only can you schedule and assign training throughout the year, but you can set notifications that alert managers of retraining requirements ahead of time. And it's possible to ensure that only the instruments, methods, and equipment that analysts are trained on are available for their use. Another essential part of enabling compliance is to be able to trace every action. Not only do we need to be able to track each action, but we need to be able to show when it was done and who did it. The workflow journal in SampleManager LIMS software enables the user to drill down from the sample record and see all the associated actions, tests assigned, completed, any data, as well as the instrument, equipment, and other resources used. We can show every action that's been done in the lab. And there's also a native mobile app that enables access to LIMS features by a tablet wherever there's an available internet or network connection. So you can access samples and execute methods anywhere securely using login credentials. It allows you to receive and move samples using either the camera or a Bluetooth barcode scanner to scan samples and select records. You can view samples and enter results through remote instrument connectivity. And you can initiate a new analysis or continue the steps of an existing process. And the mobile app is supported on Apple, Android, and Windows devices. So in summary, Thermo Fisher Scientific is uniquely positioned to support COVID-19 testing with proven, scalable, end-to-end solutions to support every step in the COVID-19 testing workflow. The SampleManager LIMS COVID-19 testing solution was designed with Thermo Fisher Scientific protocols, instrumentation, and software in mind, and enables faster implementation timelines. The option to integrate with third-party providers for patient registration, test ordering, and reporting provides a seamless user experience, and dedicated expert global support ensures prompt support in the event of any issues. And finally, I just want to touch on the Thermo Fisher Scientific Amplitude solution. The Amplitude solution's a new, highly automated molecular diagnostic testing platform with the ability to analyze up to 8,000 COVID-19 samples in just 24 hours. The modular system supports sample to result testing, and it includes automated sample registration, tracking, and delivery of analysis results using trusted SampleManager LIMS software. This solution offers max throughput with minimal hands-on time, equipment, and staffing. And for more information and a virtual demonstration of the Amplitude solution, please visit thermofisher.com/amplitude. And with that, I'll conclude the presentation. Thank you so much for joining me to learn more about how SampleManager LIMS can support COVID-19 testing.
Thank you very much, Lauren. I am sure you will all agree that there were some excellent points raised during the presentation. So To submit a question to our speakers, you should enter your question into the box on the right-hand side of the screen and click Send. We will answer as many questions as possible during the time available. We have had several questions submitted already, so I would move straight onto these. First question. Do you support instruments from other vendors?
So the solution out of the box supports all the associated Thermo Fisher Scientific instrumentation and software, but we are able to support instruments and software from other vendors, and we can swap out different components. There would just likely need to be a conversation with our services team to sort of determine what may be needed for your specific setup.
Second question. How long does it take to deploy the solution?
Yeah, that's a good question. So the timeline's going to depend on how closely your workflow matches the existing configuration of the solution. But it can be deployed in as little as 2 months. And that includes time for validation and time for training. But with, if you have different workflow steps or different instrumentation setups, it might add some time to that deployment. It kind of just depends on how closely it aligns to the configuration that exists.
Brilliant. So next question. Can you explain how this works with the Amplitude solution from Thermo Fisher?
Sure. So that's a really good question. So if you're looking for sort of a total package that's going to include the instrumentation and the lab automation, then the Amplitude solution would be the right choice for you. So the Amplitude solution is going to include the robotics, all the instruments, and the software to perform the testing, including SampleManager LIMS for the sample accessioning and the tracking. The solution I presented today is separate and distinct from the Amplitude solution. So the COVID-19 testing solution for the SampleManager LIMS would be appropriate for testing sites that need help with the organization and management of the testing workflow, from like the accessioning piece all the way through the reporting piece, but maybe doesn't require the lab automation, or if you already have instrumentation.
Thank you very much, Lauren. That's all we have time for today. Just to remind everybody, any questions that we didn't have time to get to will be answered offline as soon as possible. You can continue to ask questions even when watching this webinar on demand. A certificate of attendance is available to download from the Handouts tab on the right-hand side of the webinar platform. The webinar will now be made available on demand. If you have any friends or colleagues that you think may be interested in this webinar, please feel free to share the link. If you're looking for any supporting material from this webinar, please navigate to the Handouts tab next to the webinar stream. Thanks again for your time.